is Sergio, and I'm the supervising pharmacist in St. James's Late-Night Pharmacy within St. James's Hospital. Well, a community pharmacy, there is no real difference between a community pharmacy and a real pharmacy. Community pharmacy is that pharmacy that caters to the normal public. So somebody gets sick, goes to the GP, get a prescription, go to the pharmacy, or come out from the hospital and go to the pharmacy to get their medication. I've been a pharmacist for the last 20 years. One of the things I like the most or love the most from my job is the customers, the patients, of course. It's very rewarding to see how they benefit from medication, how the illness is controlled, how they improve. A typical shift at the moment would start with all the staff coming to the pharmacy. First thing we do, wash hands, put masks on, wash hands again, and then we start our daily routine, switching on the computers and started making prescriptions. At the moment, we are still not letting people in freely into the pharmacy. We have a stretch rope on the door because we have no door on the entrance, and we're letting people in one or two at a time, just to leave the prescription or to speak with the pharmacist, and then we get the prescription, we prepare the medication, but the patient is waiting outside. At home here is my wife, Kasia. She's from Poland. We've been married since 2012, so that's 8 years. And then is my son Max. He's going to be 2 years old in July. We are very close. We are always together. We do everything together. So this crisis has brought us a little bit closer, I think, and we can't wait to be able to go out and enjoy Ireland and Europe again. I think his first word was Aita, saying Ata, which is daddy in Basque, which is the way I've called my dad always, so it was really, really nice. So neither in Spanish or in Polish, it was in Basque, but it's the word that I've always used to call my dad, so it was actually quite special. The fact that life changes a little bit, I go to work, and then when I was coming back to home, instead of going straight to my son, I had to wash my hands again, take care of the clothes, put everything away, and meanwhile, I could hear my son, I died. There is the worry always to spread the disease at home. There is the worry, because as a health professional, you understand it pretty well, and you're extra careful. Last week, when I was self-isolating at home, that I think was one of the hardest weeks for me since I'm in Ireland, because the contact with my son, the contact with Kasia was reduced to a minimum. And it was really, really, really hard to be in bed just watching Netflix or whatever, and hearing them playing upstairs, and you can't go. You could, but it's always you have to stay yourself, and just to prevent anything. And that, I think that was one of my hardest weeks since I came to Ireland. Over 70s that are cocooning. Thanks. It's really difficult. I've seen it not for myself but for my dad, that he had to be at home for 2.5 months, only going to the supermarket maybe once a week. It is really hard, so first of all, thanks. And I think what helped him the most as well was just to see his grandson on the iPad every day. That helps a lot, but he can't wait to meet him, hopefully. I saw the other day on Aer Lingus that there was flights available, so I got him a flight for early July. I don't know if he's going to be able to come. I have no idea, but look, if the restrictions are kind of lifted, at least he has that ticket that he can get it, come here. He has to isolate for 2 weeks. He's fine about it. He was saying, listen, I've been isolating at home for 2 months, so if I have to stay 2 weeks with my grandson, it's absolutely fine. So I really hope he can come, because it will benefit him so much, and Max as well. He really wants to see him. This is the moment when looking forward is possible. When you can think, oh, maybe in a few months' time I'll be able to go back to Spain, or maybe in a few months' time I'll be able to get a haircut, hopefully. Who knows? But bring my dad over. Seriously, that would be. I don't care that much about the hair. In reality, that would be my main goal, to bring my dad here and to be able to be as a family once again. Now it's time to be positive, because a positive attitude can help a lot or immensely to people going out and coming out from this crisis.